Hello, my name is John McConnell. I'm an eye surgeon. I was a GP in South Africa for a few years, working in Cape Town at Groote Hospital. And when I decided to specialise, I came over to the UK and trained at the Princess Alexandra Eye Pavilion in Edinburgh and did most of my training there and came down to England for a consultant's job a few years later. And I've been working as a consultant eye surgeon in Kent for the last 25 years. During that time, obviously, I've seen a lot of eye conditions, and I'd like to deal with one or two of the more common ones. In the eye clinic, a fairly trivial, well, to me trivial, but to the individual not so trivial condition is blepharitis. Blepharitis simply means inflammation of the eyelids. A lot of people develop blepharitis. They may not know it by that name, but they will have slightly reddened, irritable, itchy eyes, and this is usually due to blockage of the meibomian glands, which produce the oily secretion which goes into making up the tear film. So tears aren't just water, they consist of a watery layer, an oily layer, and a mucus layer. And the oily layer is produced by so-called meibomian glands in the edge of the eyelid. And these can either because of some infection in the eyelids or simply because of rather viscous secretions become blocked and the eye tear film is left without the oily layer. This can lead to further infections in the eyelids and really uncomfortable reddened eyelids, for which the treatment is quite difficult, but there is a standard treatment which we recommend for people with blepharitis. And it does work, it's effective, but it requires discipline on the part of the individual who has blepharitis. And the treatment consists quite simply of applying a hot compress to the closed eyelids. This is best done by dipping a flannel into hot water, boiling water, perhaps wrapped around the end of a wooden spoon, and then when the temperature is not actually scalding, apply this to the closed eyelids for 2 or 3 minutes. After this, the eyelid margins should be cleansed, and the best way to do this is using either rolled up cotton wool balls or possibly cotton-tipped applicators, which can be used to rub fairly briskly along the eyelid margins to clear them of any deposits which obviously result from the inflammatory process. The standard way of cleaning the eyelid margins is by using these cotton-tipped buds or the cotton balls, which we recommend should be dipped in dilute shampoo. Obviously, you don't want to use a baby shampoo to avoid the stinging nature. And this cleansing action should then be followed by the installation of an antibiotic ointment. And the problem with this procedure is that it requires at least twice daily treatment for the first week or so, and then weekly treatment thereafter, possibly for quite a long period of time. But if done regularly and according to the method I've described, it will eradicate the blepharitis.